morning, Peter Goertz. I'm a psychiatrist. What are you getting into if you become a psychiatrist now? Changes in the practice of psychiatry in the US in the past 3 decades. In my opinion, psychiatry is still a magical profession. It's a privilege to meet the psychiatric patients, such a wide variety of people you're going to be meeting and getting to know. Things have changed though, and residency training seems to be different now. When I was a resident, a lot of our faculty, this was in New York City, a lot of the faculty were psychoanalysts and psychiatrists. So psychiatrists who were psychoanalysts who did a good amount of psychotherapy in their private practices, for example. I'm not sure if it's still that way now. My guess is probably not. My guess is that psychoanalysts are less prominent now in general. Nowadays, in the clinic where I work, things have changed enormously over the past 10 years. There are a lot more nurse practitioners. We have physician's assistants. We have prescribing psychologists in our system. So various people are prescribing medicines, psychiatric medicines, and that potentially crowds out the psychiatrists. So people who require less high salaries are prescribing, to a large extent, psychiatric medicines now, and hospitals and clinics are saving money that way. And with psychotherapy, a lot of psychiatrists nowadays do not do much psychotherapy. And if someone is a psychiatrist in private practice, reimbursement for psychotherapy is generally not as high as for medication management. So there's an incentive for psychiatrists not to do psychotherapy, unfortunately, in my opinion. And psychotherapy is often done nowadays by psychologists, social workers, licensed professional counselors. Another aspect is electronic medical records. They were non-existent when I was a resident. We used to check lab work in electronic medical computers, but that was about it. And what I've been doing for years now with electronic medical records is writing my notes during visits with patients. So I sit across from the patient, I have a laptop in front of me, the patient's in front of me, and I just write as the patient's talking in order to save time. In the olden days, when I was a resident, I would write some notes by hand while the patient was talking, but then after the visit, I would take like 10 minutes to write the final note by hand. So different system, and I guess one saves time by writing notes in the computer while one's seeing the patient, but there may be something lost. I try not to have anything lost. I mean, I do sit right across from the patient, I speak with the patient, but at the same time I write notes, and if I need to, I can check lab work then at the same time. And a lot of the time you're going to spend, and I guess that's in any profession nowadays, a lot of your time is going to be spent on the computer. So that can have effects on your posture, on your vision. Somewhat of a different world now compared to 30 years ago. I do take advantage of the fact that things are done to a large extent by a computer because, especially since COVID now, virtual visits have become commonplace. And I'm able to work virtually, at least for several weeks every year. Personally, I prefer in-person visits. I think something gets lost if you see patients virtually. Obviously, some things get lost. You can't do a physical exam, like, for example, with patients on stimulants, ADHD patients on stimulants, I like to do physical exams, like check their heart, listen to their heart, check their pulse at the same time. Same thing with patients on antipsychotics. I like to check them physically for extrapyramidal symptoms, stiffness, tremor. Medications have changed over the years also. When I was a resident, to a large extent, people were still getting conventional antipsychotics, so first-generation antipsychotics. During my residency, the second-generation antipsychotics started coming out and became more and more prominent. And then one realized a little bit down the road that the second-generation antipsychotics were, of course, also not without side effects, like weight gain, high glucose, high cholesterol, for example. Nowadays, even the meetings with staff, even the staff meetings in our department, a lot of people attend them virtually. So it's a different feel nowadays at work. There's less direct contact with people, less with patients and staff, less direct contact. And even the APA meetings, so the American Psychiatric Association annual meeting, I've been attending virtually. I mean, I've been doing it after the fact. I just listen to the courses and hear what people are saying after the meeting is finished. It could be like months after the meeting. And hospitalizations now tend to be quite brief, however, unfortunately repeated then often. And state hospitals are becoming fewer and fewer, is my understanding. And in my opinion, there is a place for state hospitals. Some patients do require longer-term hospitalization. So the whole situation has changed quite a bit for psychiatrists, but bottom line, in my opinion, it's still a magical, wonderful career. Thank you.